A warm welcome to everybody. Really delighted that we're hosting this happy hour. This is our 104th happy hour since we commenced nearly 4 years ago. And it's really great that we're looking at health and housing issues today. And we're taking a broad look, both sort of at a regional level, very much from a sort of looking specifically at sort of some of the evidence around why it matters, as well as looking from an operator, what are the sort of practicalities and sort of issues around greater integration, collaboration and partnership working. Many of you may not be aware that the HousingLIN used to be part of the Department of Health. And indeed, we were part of a team called the Integrated Care Network. We were very much an early adopter of integration. So it gives me great pleasure that we are continuing that theme at a time when policy practice is really looking at how to drive those partnerships much more effectively. Only a month or two back, we heard from the Lord Darzi and his review of the NHS, setting out that we need much more integration. It contributes to early intervention and prevention. It also supports better care and enable people to live longer at home. Some of the sort of early findings of his work are now feeding into the plans for an NHS 10-year plan. But health doesn't do it alone. It also has to work with a broad range of agencies: health, social care, housing, transport, the built environment, you name it, planning included. And on that note, we're really pleased that we're being joined by a stellar cast to look at both how to plan much more effectively, and first-hand on a regional footprint with Fiona Brown and Sean Cocking from the North East and North Cumbria Integrated Care Board. And then Miranda Foster, who's Head of Programmes and Products at Homes England, is give us an overview of the research they've commissioned around those partnerships and why it's important that there is sort of a dividend of engaging with health and how housing contributes to that dividend. And we're going to conclude with Ruth, who's the Executive Director at Care and Support across the East Midlands, with East Midlands Housing Association, with a large portfolio of delivering frontline care and support services, both into mainstream housing, but also into specialist and supported living. We'll then have a short Q&A and panel debate before we bring this 104th happy hour session to a close. So on that note, I'm going to pass over to Fiona to kick off, and it's delighted that you can join us. Many of you will have seen Fiona at previous happy hours because she's also a board member of our TAPPI project. So HAPPI and TAPPI are aligning here nicely. And Fiona, over to you.
Thank you very much, Jeremy, and thank you very much for the opportunity to share the journey within North East and North Cumbria. So my name's Fiona Brown. I work for North East ADAS. And I'm joined by my colleague, Sean Cocking, who works for North East and North Cumbria. And I'm sure Sean will introduce himself as we hand over on the slides. Next slide, please. So the Housing, Health and Care programme within North East and North Cumbria really came about on the back of a number of policy directives, not least the Adult Social Care 10-year white paper and white vision, also the ICBs being formed. And really, we brought together a couple of conveners within the system, which was North East ADAS, Northern Housing Consortium, which represents all of the local authorities in the region, but also all of the housing associations across the north, including the North East. North East and North Cumbria ICB, and the Voice of Technology Enabled Care TSA to help us build in those TAPPI principles. I think what came out of those early conversations was a real strength about people understanding the impact that housing can have on an individual's health and social care, not least whether that is damp and mould in someone's house, impacting on their respiratory problems, but also just how that feels in terms of someone's mental health or mental well-being if they're in a situation where they're not happy in their home environment. So those 4 system conveners came together. We had a number of conferences and a number of conversations to understand what it was we wanted to get out of our programme. And we feel we're putting citizens right at the centre of that and being able to say, I'm healthy, I can live the life I want to live and do the things that are important to me as independently as possible. Next slide, please. So in terms of setting the foundations, we've done a number of things. We've taken time to understand what our challenges and opportunities are, and Sean will take you through some of those later in the presentation. We are regularly playing back and shaping the early stages of the programme to agree our priorities. And those priorities are threefold. So we have older people, those over 65 with minimum of 3 long-term conditions. We have people with complex needs. Perhaps some of those people are stuck in some institutional hospitals, and we're looking at making sure that we've got enough warm and dry homes across the North East and North Cumbria. We have undertaken a detailed baseline assessment, and it's the first time that's been done on the regional footprint within North East North Cumbria, and we work closely with the HousingLIN to do that. So we've got baseline needs assessment and gaps across those 3 priorities. And we've got consistent, powerful and recognisable messages from all of our local places. So we've got all of that baseline assessment on a regional footprint. We've then got it cut into both of our combined authority level, and we can take that data down to an individual place and local authority level to understand our needs and our assessments against those 3 priorities for the next kind of 5-10 years. And as I say, that's something we've never had at a regional footprint before. We've also brought system leaders together. We worked with the University of Stirling. We did something called a serious game, where it's literally a big battleship game where we get in a room, we get some problems, we try and solve them as a system. You play a different role to what you are in real life. And it was really interesting to see that system come together and start and talk about how we could perhaps solve some of those problems that we see every day. Next slide, please. We've also established a programme board from across all sectors. We've got representation from ICB, we've got representation from community of practice, voluntary sector, etc. And we're just about to sign off a memorandum of understanding that will set out a shared commitment to joint working with co-production at the heart of everything we do. It emphasises the role of good housing in ensuring good health and wellbeing for citizens. It includes priority actions and the shared success criteria, so we understand what success looks like in 5 and 10 years' time. But it also ensures that we've got oversight and delivery of the wider programme. We're working with combined authorities to support those ambitions, but we have also set up a really successful and vibrant community of practice, which Sean leads on, which again has got a diverse membership of frontline staff, people with lived experience. And we meet together probably every 2 months, where we have about 80 people who come together to try and understand what things are making you happy, what things are causing you some concerns, and how as a system can we work together to try and improve things. And we've recently just set up 3 task forces across that community of practice to represent the 3 priority areas that we've got. Next slide, please.
Thank you very much, Fiona. So as Fiona said, my name is Sean Cocking. I'm a commissioning lead for the North East and North Cumbria Integrated Care Board. Just going to talk a little bit about a couple of our priorities within the programme. So the first one is complex care. That's focused around people with a mental health condition, people with a learning disability, and autistic people who are at the most risk of being in restrictive environments, whether that's an inpatient service or a care home or in the community. And that group of people who we'll all recognise across our system need really focused, really creative thinking in order to kind of help them live good lives out in the community. The baseline tells us that there's about 3,200 people who might need complex care and support. That's across our inpatient services, our care homes, and people on our dynamic support registers. We got really consistent feedback from all of our partners when we were doing the engagement on the baseline about some really key gaps in our provision, particularly where people have intersecting needs and experiences. So people who have mental health conditions, who have also experienced or at risk of homelessness, had substance misuse issues. We end up in a situation where people are kind of bouncing between services because they're either too complex for some or not complex enough for others. We're seeing a real changing profile in people who are in our inpatient hospitals, significantly higher numbers of autistic people, people who've been in contact with the criminal justice system, but also people are staying significantly longer than they need to be, and that's having a massive effect on their health and well-being and on their ability to kind of get out of the hospital into the right home with the right care and support. We've estimated that across the whole of the North East and North Cumbria, we need to either find or build about 350 homes a year for people who need complex care and support, and even with a integrated care partnership footprint as big as North East and North Cumbria, that's a huge challenge for us in terms of kind of finding the space, finding the funding, which are the kind of things that the Housing, Health and Care programme are seeking to understand. So out of the programme, We want to create a better understanding of our long-term need and demand for supported housing for people who need complex care and support. I think we, like a lot of systems, we are in a bit of a reactive position at the moment, and we want to kind of get on the front foot and think 5-10 years into the future. And we want to do that by taking a regional or a sub-regional approach to the way that we undertake market shaping, planning, commissioning and delivery. So actually getting local authorities, the health service, providers of housing and social care providers working together and thinking across local authority boundaries where it makes sense to do that. And we're also looking at ensuring that people have the best access to the widest range of really good quality homes across types and tenures, whether that is making sure that we've got good quality, consistent advice and information for people about what their housing options are, or starting some work with in one of our task forces that Fiona's just mentioned, thinking about how we can develop design standards for how we design homes for people who need complex care and support. One of our other priorities that Fiona mentioned is around older people. So this is focused on people who people over the age of 65, people who are experiencing dementia or other kind of long-term health conditions. Quite a significant increase in our population over the next couple of decades, but 28% to 2039. We know that across the northeast and North Cumbria we have a higher prevalence of dementia across 9 out of our 14 local authority areas, and an increase in dementia-related care admissions as well. About 1 in 5 of our older people experience income deprivation, which really can limit people's options. And if we want to avoid divert 10% of our older people from care homes, we think we're going to need to find 525 homes every year of extra care or sheltered care type accommodation. So some of the work that we're doing within the programme around older people, making sure that we've got good quality, good access and good quality care ready and age designated homes across types and tenures right across our region. So that's looking at where we need to be developing retirement living, sheltered housing or extra care. We're doing some great work with all of our local authorities across the region to look at how we're providing disabled facilities grants and reablement to make sure that we've got that consistent offer and approach across all of our places, and also working with our integrated urgent community response teams to make sure that we're able to support people in their community, in their own home, and avoid people going into hospital or into care unnecessarily. So I'm not going to go through all of this because it's a really busy slide, but this is our 5-year plan that sets out the challenge for each of our 3 priorities and some of the things that we'll do, which I've kind of just talked around. So for older people, maximising access to home adaptations, care ready, plenty of better supply of care ready homes and dementia friendly housing approaches. And for our complex care, having a detailed long-term strategy and a long-term plan alongside high quality homes and kind of really specific design standards to support our providers and our developers. Over the next 5 years, what we're wanting to achieve is more older people living at home in better quality homes and fewer people in care or in hospital. And for people with complex care, making sure that they've got access to the full range of housing options that allow them to kind of live an independent life in the community. And just on this last slide, some of the key things that we're working on at the moment. Fiona has played an absolute blinder and got agreement in principle from our regional planners on accessibility standards for age-friendly homes across our local authorities. We're doing some really great work with our local authorities about consistent approaches to the way that we provide things like reablement and disabled facilities grants. We've got first stage approval for up to £8.4 million worth of NHS England capital to create the first sub-regional housing with support schemes for people with complex care in the region. And we're working with housing developers and housing providers and our local authorities to build a really clear picture alongside our regional baseline, a really clear picture of our five-year development pipeline for older people and for complex care. And the final thing we're doing is some really exciting work between Integrated Care Board, data and performance experts and data and performance experts from Carbon Homes, looking at how we can integrate and combine different sets of housing and health data so that we're able to identify hotspots and target interventions, focusing on our warm and dry priority. And that's my last slide. Thank you very much for listening. I will work out how to stop sharing.
Okay, Well, Fiona and Sean, thank you very much. Really illuminating lots of rich content, both in terms of the strategy, how you're setting that out. What I like about it, it's not just about new build, it's also about looking at our existing stock as well, adaptations, looking at affordable warm homes as well. I'm sure there'll be some questions about, about that, because it's not just about the capital money for new build, it's also about, how to make better use of things like the Better Care Fund and other inward investment opportunities as well. Perhaps we can talk about that later, because I think investment and why we invest in our homes and communities is something which is at the heart of what Miranda's all about and what she does at Homes England with her and the team. So over to you, Miranda, as a segue.
That was very nicely teed up there. I think actually it's going to all look a little bit too scripted, following on from Fiona, because we didn't share presentations beforehand, but the wellbeing thing is brilliant to listen to, because that's what ours has started from. To give a bit of background for this, Homes England have released, and some of you may have seen it, the latest in our research series, which looks into the wellbeing benefits of older persons housing. Why did we do this? It's something that we know that it has wellbeing benefits, and I think we've certainly seen from Fiona's and Sean's side of things that you can see this coming through, and it's something that we all believe to be true, is that there are wellbeing benefits to being in the appropriate type of housing, both mental wellbeing and also physical wellbeing. But it all really comes down to money, doesn't it? And no one can fail to see that the country is facing some really difficult decisions right now about how to allocate limited funding. And so we carried out this research to be able to quantify those wellbeing benefits and to be able to show that there is a cost benefit in the way that the Treasurer needs it shown. So for those of you that haven't come across this before, there's a green book, which is the way of appraising benefits, and that's what we've set out to do. So in this, there was a range of housing, obviously designed for older people, and that's one of the things that we fund. Can anyone hear me? My screen's gone completely blank right now.
I can hear you, Miranda. Your screen, I can't see you. I think that's gone blank. I'm not sure if your slides have also frozen.
Have we got how people who live in older persons housing?
Yes, I can see that.
Wonderful. Okay.
Yeah.
Well, I can just about see a small square of my screen, so I'm going to wing it and hope that I'm telling you what my notes told me that I was going to tell you. So typically, how at Homes England we work is in a number of different ways, but it's enabling other people to provide housing, and obviously we use, amongst other methods, government grant to do that. So typically when you're looking at economic benefits of us intervening, it's all done on land value uplift. But what that doesn't do is capture the associated social value that's so important and that we've heard about.
Sorry to interrupt, Miranda. I think a couple of people can't now see the slides. Is it okay if you stopped screen sharing and I will pop your slides up on screen for you? And then you can just say next slide.
I can stop the whirling button of death is coming up. I'm going to see, I think it's going to log me out, so I might need to log back in. One moment, please.
I might be able to override it. Can you see your slides now? Oh, great. I think everyone can see your slides, but I think, Miranda, you're now off screen.
Yes, I think with a cold snap, Miranda's screen is frozen. So I'm wondering if Miranda may rejoin us. I think she's logged off now. If we just give it a couple of minutes and make sure that happens. Otherwise, if Ruth wouldn't mind, we'll move on to Ruth and then come back to Miranda afterwards, if that's okay with you, Ruth. Thank you. Sally, should we do that? Should we move on, and then if you liaise with Miranda behind the scenes, that may be.
Yes, will do. Yeah, great, Ruth. You should be able to share your slides now. Thank you.
Thanks to Jeremy and the Lynn for the invite, much appreciated. Obviously the scope and brief itself is quite broad, so hopefully I do that justice for you all, but if not, it's the end of the day, I can't see you all, so feel free to nod off while I'm on, if that's what you want to do. So I'm Ruth Jennings, I'm the Exec Director of Care and Support, as Jeremy said, for EMH. We've been around for about 3/4 of a century, and we were set up initially to provide housing for veterans following the Second World War, but we now have about circa 20,000 homes across the wider East Midlands. And I'm responsible for the charity arm of Care and Support that's part of EMH Group. We run a range of services for adults with a learning disability and or autism, and we provide specialist supported living, and you can see a couple of the pictures on the screen at the moment. The top one's our newest build, because we're one of the few providers that are building new supported living at the moment. We also provide specialist nursing care and day services. We also run 4 of our homes independent living services for extra care, which is the ones on the right hand side. That's our Springfield scheme in Ashby-de-la-Zouch. And we also run specialist supported housing on the homeless pathway, which is the bottom one that's there, and that's just opened for us in Blaby in Leicestershire. We are looking to provide probably another 2 independent living extra care services over the next couple of years that we've already committed to. So we also provide regulated care activity. That's probably to about 500 customers at any one time, and we deliver about 15,000 hours and contacts per week, with a turnover there or thereabouts £20 million. So back to the question, why is integration so important? Well, I believe you can't have good health without good quality housing that actually meets your needs. One of the greatest impacts on poor health is someone's home, both the bricks and the mortar, but also how they live in that home. Can you afford to heat it? Is it damp? Is it cold? Do you have to keep moving every 6 months and you can't put down roots? Is outside well lit for you if you're registered blind? Are pathways uneven or broken? Are there too many steps for you to get out and about? Is your street full of parked cars and you can't get your mobility scooter by? So all these issues are resolvable with specialist type accommodation, but they're all issues that add to the likelihood of poorer health continuing. And can our NHS actually control this? And of course, the answer is no. This is a housing issue that impacts on health. And this is where we definitely can have impact on the wider determinations of health in our communities. So we need to work together to understand the root causes of poor health and plan for them together. Right, my slides are not moving on now, so I'm not sure why.
There should be the option on your bottom left of your slides. Very faintly, there's arrows. You should be able to manually click that, or on your keyboard.
It's not. Aha, there we go. Sorry about that, everybody. So we've got some shocking statistics up there on the screen at the moment, especially the ones somebody mentioned earlier, the presenters earlier about homelessness and the impact on homelessness to someone's health. In one of the largest economies in the world, we know that we also have about 150,000 children living in those temporary accommodations, much of which will impact on their longer-term physical and mental health, and many already have longer-term health problems from living in temporary accommodation. And it's pretty ironic, really, that our system gives people no choice in this, but then the millions of pounds it costs us in the future when those choices impact on people's health. You'll see the death rates in street sleepers now match the average death rate in working class people in Victorian times. And society still treats this community as the problem, not the system that forced them to take that option. The majority of people in our temporary accommodations, and those who are street sleepers, understandably have high rates of physical and mental health problems, resulting in many hardships and sometimes abuse over several years of their lives. Most of our people also that are in hospital that stay longer than their medical needs determine that they need to be are our older people, and this is mainly because they can't access domiciliary care. It's not available when they need it to come out, or their home actually just doesn't meet their needs, and they're stuck in that cycle. So, you know, all our adult social care partners, health partners, local authority partners and housing partners, are we truly creative with our budgets in working together as a collective to impact our health outcomes? 1.5 million new homes sounds fantastic, but do we really know what we need as a nation and where those needs are, and where specialist supported housing can help meet those needs? And do we, somebody mentioned earlier again, whether we understand and have access to each other's data? Do we crunch it together when we're making our plans? And is this how we truly plan for prevention and try and turn the tanker of the NHS around? Specialist supported independent living, or supported housing it was referred to, still has no commitment within the new budget for long-term funding since the Supporting People funding was removed. Yet the impact specialist housing can have on population health is enormous. We often have care teams and support teams already in place, no need for delayed discharge. We know our customers have reduced visits to hospital and often reduced stays even if admission is needed. And we know that initiatives like our wellbeing services actually improve people's health and reduce the need for health interventions in the primary care pathway, like GPs and district nurses. And many providers in the sector are already or are nearing achieving full digital care planning data and have digital monitoring solutions already procured and in place, which with some really rich data. So how do we go about sharing this and achieving great things together? But without the commitment from government to long-term funding in the care and support housing sector, providers will continue to withdraw as they have done over the past couple of years, and this will have a direct impact on our adult social care, our health, and our NHS services. So we've looked at some of the challenges. What about some of the solutions, and when we work together, where we get it right, really? I want to talk to you about our wellbeing services. So thank you for the segue from the speaker before about wellbeing. Over time, due to CQC separating out, wanting to separate the housing and the care out, and how adult social care commissioning works, there's many dedicated independent living providers lost their care contracts within their buildings, and this has made operating models fail, and they're now withdrawing from the market, especially in the social housing part of the market. This happened to us in our 3 Leicester independent living schemes that are for older people. Our satisfaction figures then as a landlord fell as the care providers changed every 3 years with those commissioning cycles. And the wellbeing was actually commissioned as part of the care contract, and invariably it became really patchy and then decimated post-COVID, where the care providers would consistently pull the wellbeing activities to use their resources to deliver the care because of the impact on recruitment and retention in the adult social care market at the time. So about 2 years ago, our customers voiced their dissatisfaction, and we met with them and our commissioners about their wish to return the service back to a landlord function. So all of our services now have wellbeing as a landlord function, and all our future models will. Our customers agreed, they all unanimously agreed to pay for that themselves. And the charge is around about £10 a week for our wellbeing services, which is included as part of their tenancy and their service charge. And although it's non-eligible for housing benefit, people valued what the service brought and what it delivered for them with regard to their physical and their mental health well-being, that they were more than willing to actually pay for it themselves. We helped people maximise their incomes through their benefits that they didn't realise that they were entitled to. But importantly too, it saved the local authority nearly 80k within their commissioning round at that point, and a saving to the public purse, or they can use that funds obviously to meet their statutory care needs. So we run our wellbeing service on the principles of taking 5 steps to wellbeing, and that was produced with health and social care, and we're starting to collect statistics to help the message really at the moment. So I'd just like to share with you, if I may, some of our outcomes of our wellbeing service. So, oh, sorry, I've flicked on too much. So I'd like to share a story at the moment. You'll see some photographs on the screen, and on the left-hand side, there's 2 gentlemen with a beautiful barn owl. The bottom gentleman is Malcolm, and he's happy to share his story with us. Malcolm's wife had Alzheimer's, and they lived in their family home. And unfortunately, Malcolm's wife sadly passed away. However, she was his main carer. He was wheelchair dependent and still is. He's also registered blind. He had become so physically inactive, extremely lonely. His mental health and physical health had deteriorated to such a rapid state that he had repeat visits in and out of hospital, and he drew heavily on GP services. As you can see, Malcolm's wonderful smiling face there is the heart and soul of our service at Oak Court. He's now thriving, thankfully, thriving and alive, as he calls it. And although he still draws obviously on primary care with his GP for medications, etc., in his health, he's not had one hospital admission since he came to live with us. And Malcolm's been with us about 18 months, I think, now. Here's a little story. There's our St Mary's crew that won the contest against the local college students, the quiz, so they were quite happy about that. But that's just a little bit of community really, and our intergenerational work and learning from each other. And here there's some stories on there, and really that's just to demonstrate that we're out in the community. We're not just within our services, and we benefit the community, we interact with it, we raise funds and money for it, we use its services, and our people are very much active members of our communities that we are in. So if we've got enough time, hopefully Jeremy will stick his thumbs up at me. I do have a video for you. We talked about Malcolm. He was very passionate about supporting Alzheimer's Society that supported him so well when his wife passed away, and he wanted to do the memory walk in memory of her. So I'd just like to play that for you. Is it playing? No.
I'm afraid it hasn't
Oh,
started yet. It may be just the size. It may just take a little while. Give it a minute or so. Give it a few seconds or so.
we're having technical nightmares today, aren't we?
Ruth, please don't worry. I mean, these things happen. The beauty about what we do is we pull these things together and we will share it with all the attendees after the event and put a link to it if it doesn't stream in a moment. Yeah, no, it looks like it's not going to. You may just need to move on to the next slide, in which case, but we will certainly share this with the attendees along with your slides and the recording.
Well, if my video's not coming up, Jeremy, that's kind of it from me, from provider's point of view. So I think Miranda looks like she's popped back up now.
Well,
so.
that's great. Ruth, thanks very much. And you know what, I was really struck by and what I really liked about how you kicked off the session was, it's not just about older person services, it's also thinking much more broadly about the well-being of all people. And you focused a little bit on homelessness, which you provided some stats which I wasn't aware of. So thanks very much. I found that really beneficial. And of course, we're seeing an increasing number of older homeless people as well. So yeah, no, that was really fascinating. And I'm really glad to get your perspective from both EMH, but also from your localities that you work in, and I'm sure there'll be questions we come back to in that. But can I welcome Miranda back? Miranda, I was messaging Sally behind the scenes saying, "Oh, I see Michael's on the screen. I might call him to see if he wants to say something." But we've got
him back as well. I could have gone and got him to do it. I didn't know that.
Yeah. But well done for coming back. Yeah, we can hear you loud and clear. Back to you.
So, quick recap of what we had last time. The reason we did this research was to be able to articulate to Treasury and also for you as a sector to be able to articulate to decision makers the financial benefit of that well-being. So it's really important to be able to actually define that as a thing. So there were a couple of different things done as part of the research. One was primary research of surveying older people in various types of accommodation against a control group, and various means of doing those surveys, and also looking at existing research out there to see what we could quantify via that. So as part of it, the first bit for us was to actually define what we mean by well-being, and this is what we came up with. It seems to align with, I think, the past couple of people talking here of we're all talking about a similar thing, how people are doing as a whole and how people are doing individually. And we use the ONS well-being framework as a basis for that. So on to the next slide. One of the things we did first was to work out a set of the typologies of housing. So how we were going to categorize it. And to do that, we spoke to lots of stakeholders across the sector, the ministry, and referred to the National Planning Policy Guidance. And from that, we drew 3 typologies. So the first one, typology A, was age-restricted general market housing. So that's sort of your standard 55 plus and active elderly people. It might have some shared amenities, a communal lounge, communal garden, but it doesn't include support or care services. So that was our typology A. Typology B was retirement living or sheltered housing. So these were typically purpose-built flats or bungalows with limited communal facilities, so a lounge, a laundry, guest room, that sort of thing. Generally not providing care services, but providing some support to enable residents to live independently. So things like 24-hour on-site alarm assistance or a warden or a house manager. And then typology C is extra care housing or housing with care. So most of you will be familiar with that, of purpose-built or adapted flats and bungalows with medium to high care available through an on-site care agency that's CQC registered. So residents are still living independently but have 24-hour access to support services and staff, and typically meals also available. And with those, we see more extensive communal areas and activities and so on as well. So those were our three typologies that we used to define this and to do the research against. And our key findings when controlling for the things that we could find were that there was a better life satisfaction than in the comparator group, i.e. outside of older persons housing, but particularly higher levels of happiness for those in typology B and C, and being more confident they're doing things that are worthwhile for those in typology A. So the wellbeing questions are set out into four main categories. There's personal wellbeing in life satisfaction, relationships, health, and where we live. So you can see on screen the things that came into that. So moving on to the next slide, the important thing, the money. So we reviewed existing evidence and found various areas identified where it looked like there could be a financial saving. So things like healthcare, local authority social care, housing benefits, employment effects. So although we looked at all of these things and previous speakers have all alluded to it, we know that they exist. There was only robust enough evidence to meet the Green Book standards in relation to healthcare benefits. But firstly, on the wellbeing benefits. So with this, we use the wellbeing guidance for appraisal to monetize the uplift. This is looking at the results from surveying all of these groups and seeing how much of an increase there was, and then there's a standard way of quantifying the benefits of that in terms of social value. So these values are per older person per annum, and they do have future years discounted to meet the Green Book requirements. But I think what we can see here is that there are benefits across all of these types of housing, and this is directly linked to the wellbeing scores that the survey respondents came back with. So they were broadly as expected, we thought, but the one part was extra care was tracking lower than the others. Looking into that a bit more, we believe it's because people entering into that stage of accommodation straight from the general market typically have more health conditions anyway, and so may report lower levels of satisfaction. But you can still see even in that there is that relative to the comparator general needs housing, there's definitely an uplift and still important there. So what we can do with this information is we can then feed this into when we're looking at potentially new affordable homes programs, is starting to be able to say that, we know this accommodation is more expensive. We know from talking to you as a sector how difficult things are financial viability wise, not just the capital upfront costs but also the ongoing costs. Now what this allows us to do is really demonstrate that yes, the higher capital upfront costs you'll see for these specialist schemes are there, but equally there is a benefit on that side of things. So it just turns that benefit cost ratio to make it look better, and hopefully allows us to deliver more with this. If we go on to the next slide, so I mentioned that there was a review of the healthcare benefits as well. Now, this is based on evidence that meets Green Book requirements. So it's not to say that this is everything that there is, because I think anecdotally we all know there's more, but this is what we could quantify right now for it. And what you're seeing in this is the typology B and C, so the specific retirement living or extra care housing, does have a financial saving per year, not massive in terms of the GP visits, but still £8 per person per year, and you multiply that up and it's got an impact. But really importantly, that extra care housing, and I think again all the other speakers have alluded to it, that reduction in admissions to hospital and that reduction in the length of stay and delayed discharge, you can see real quantifiable benefits there for extra care housing. So if we move on to the next slide, I just wanted to finish off, I guess, with an example. There's so many we could give. We work through partners, we don't deliver housing ourselves, but it is amazing to see what all of you as a sector are delivering with the grant funding we've got. So Prima is a small housing association. They operate in the Liverpool City region and Greater Manchester. They are a general needs provider, but they do specialist work as well. This is a commissioned new build scheme, and it was for 19 one-bed accessible apartments for clients with diagnosed mental health conditions, and a potential of some multiple occupancy apartments as well. 24-hour care and support on site, but each client has their own tenancy, which is what makes it eligible for our funding. And one of the things that I wanted to draw out of this particular example is that we talk about the integration of health and housing, and that was really the remit for today. So the Prima worked closely with Tameside Local Authority and the Care Commissioners to jointly develop this scheme, and that's come out in good results for the residents. So there's a lot of communal space here, so co-living, therapy, education to meet the needs of the group. The thing about that communal space when we're grant funding it is really expensive, because the way that our grant funding works is on per home that's delivered. So 19 of these homes were delivered. 50% of the square footage of this isn't technically a home. So on paper it can look really expensive, and that's where starting to build up this evidence base of saying, yes, it's expensive, but these are the benefits, is so important for us. Yes, I'll finish on that, but we are continuing to work within our resources to do more research. We're currently looking at the wellbeing benefits of temporary accommodation and starting a research project on that. And there are lots of areas to explore for both Homes England and the rest of the sector. In terms of the report, it is published. All of the information, the appendices are all online. I think Sally's already put it in the chat very efficiently. So you may use it. You can use it to talk to boards, talk to your local commissioners and so on, local authorities. We think it's something that is out there for everyone now. That's all from us.
Miranda, thank you very much, and I'm really sorry you had to sort of take a break, but thanks very much for coming back and finishing that presentation. And I think both the evidence around the cost benefits and the value in terms of the social value around the wellbeing offer, but also the real key information about the both the system improvements, but also the potential reallocation of resources and for health and social care through providing a better housing offer. So it speaks volumes in terms of the numbers that you sort of shared with us. And I know that some work that Lynn's done with colleagues, some who are on the attendee list today in Southampton, sort of demonstrated very similar figures. So again, I think that's a really useful benchmark, and I wish you all the best with those ongoing conversations with Treasury, because I think it also sets an agenda going forward for not just the capital, but also to demonstrate why the revenue is important. Because I think, as Ruth sort of highlighted, both sort of planned care, self-care, service charges, all those issues will really come to the fore. We got a few questions in the Q&A box, and we've got a few sort of observations in the chat box. But let's kick off with the Q&A box first, in the sort of 7 or so minutes we've got left. The first question is, I'm interested to know the panel's views around incorporating housing into EHCPs as part of integrating housing into wider health assessments in complex children's cases, of which we're experiencing a large increase in cases. While the focus this afternoon has been very much around working age adults and older people, do any of you have any experience from a younger adults and children's services that link into this?
Not necessarily direct experience,
sorry.
but what we have done is when we have done that baseline assessment, we've worked with directors of children's services colleagues, and we've also our age group, I think Sean will keep me right, is 11, starts at 11 for people with complex needs. Yeah. And I think it's interesting to see if there would be a policy conversation similar to we have with adults. You know, every time you have a conversation about care, that should be a conversation about housing. Be really positive to see that flipping over into children's conversations as well. But I'm not sure if Sean has anything further he would want to add to that.
I mean, I'm not intimately familiar with the HCP guidance, but it sounds like something that would be really beneficial. I think one of the things that across the North East and North Cumbria and other systems, I think, is that we're not necessarily thinking far enough into the future about what people's needs will be, particularly people with complex care and support needs. We've got a lot of children in residential placements, in unregulated placements, and finding the right housing for them is really tricky. So I think that the idea of thinking about where people need to live longer term would be a great one, and it's a really interesting kind of policy discussion to pick up, I think, which we'll be hoping to address through the strategy.
Thanks for that. Alex asked the question about how do panel members employing organisations and their collaborating partner organisations share data to put the citizens at the centre? I think we all talk co-production, person-centredness, but does data often follow that as well? So again, any thoughts around how to utilise that data? I think, Sean and Fiona, you talked about the importance of data in terms of shaping your strategic decision makings. Some of that obviously anonymous, but where it's person-centred, any things that you can sort of draw attention to, or Ruth or Miranda?
I think if I come in from a provider point of view, if that's all right, Jeremy.
Please do.
From an adult social care point of view, I think our journey to digitisation is a lot later than the NHS. So I think there are a lot of statistics around public health data, but not around the actual individual draw on services and what that looks like, and mapping that out and drawing it together. So I think we're starting on that journey is what I'd say, and I think there will be benefits, as I've sort of said, you know, by 2025 we should have care planning in adult social care. I think it's like kind of overlapping data, isn't it?
Yeah.
It meaningful all the way through. So I think we're on a journey in adult social care, but I think we're a little behind health in that way, but hopefully we'll have some important stuff that will start to feed into the sausage machine.
Yeah, well, I think, Alex, I think your question is really important. And perhaps it's something we can also have a conversation with the regulator of social housing as well, in terms of the relationship around person-centred data sharing and trying to get that real important qualitative information that can aid sector improvement and sort of care and support that that well-being. But the final question is from Philip, a really interesting, well done for a brilliant report, Miranda. Really wanting to know whether people have looked at things like the Extra Care Charitable Trust research and whether there's any sort of comparative analysis being done in relation to the sort of fiscal measure, the finances. I don't know whether the economists did that in terms of the methodology, but obviously there are a range of reports. Any knowledge behind the scenes on some of this?
So I'm not going to pretend to be one of the economists. I'm not that smart. Yeah, so what they did was did a sort of meta research, so looking at all of the research out there. The things that could be included are the things that meet Green Book standards. So and again, I'm not going to try and explain exactly how that works, but they have certain criteria it has to meet in order for it to be something that could be used. So yes, a review of the existing research was done as part of it, of what was available at the time, in terms of how it compares. Yeah, it's interesting to keep looking at these things and keep reviewing, and I think using our research as a springboard for your own is something we'd absolutely encourage.
Yeah, and I think that that's really good. And I think your research alongside the Aston University, which helped inform the Extra Care Charitable Trust work, and a range of other resources are critical for sort of building the body of evidence. And there's also work that's being done, I think, by the University of Exeter to better understand some of the funding of extra care housing as well at the moment, which we hope to get some further details on for next year. So again, I think there's a real growing evidence base that's available, and in fact the LIN curates a web page which sort of tries to pull together all the latest research findings so that colleagues can sort of access that at first hand and free at the point of delivery as well. So we'll put that into the chat box. But that also leads me very neatly to thank everybody for their contributions this afternoon. We're just about to hit 5 o'clock. It's been a really fascinating conversation. Fantastic presentations, notwithstanding some of the technical glitches. But as Sally said in her introduction, we'll be sharing the slides with the recording, the feedback and the chat from today's session in an email to everybody who's registered in the coming days. Thank you very much to all our speakers for making this a really important session, really pivotal in terms of developing our thinking. If you found this of interest and this is the first time you've joined one of our happy hours, we tend to run these every Tuesday. Next week, we're putting the focus on intergenerational living with Intergenerational England, some really important research that's been done by HACT along with Sovereign and Clarion Housing, as well as some charities that are working in this space. So if you found that of interest, join us for our 105th happy hour next week. But in the meantime, please do complete the feedback forms. And can I also thank Sally and the team behind the scenes for helping out to put on such a wonderful session this afternoon. Have a warm evening, everybody. Thank you.